Welcome to the Plan B channel, where we provide information about HIV that is accurate, unbiased, and fully up to date. My name is Ben Plumley, and I am a global AIDS strategist and advocate, and I've spent my career working to provide information to people living with HIV about HIV treatment so that they can live long and healthy lives. In this episode, we are going to be covering low dosing strategies. And I'm delighted that we're joined by Dr. Royce Lin, an internationally respected HIV specialist from the United States of America, and he is Associate Clinical Professor at the University of California in San Francisco. Dr. Lin, welcome.
Thank you, Ben. Happy to be here.
So in this episode, Dr. Lin, we would really like to talk about low dosing strategies. And a number of our patients have read stories, heard about research that perhaps look at ways of reducing the dose of medications so that while they might potentially have the same efficacy, a lower dose would give them a lower side effect profile and also mean that they are cheaper. What advice do you give your patients about low dose strategies?
Yeah, that's a great question, Ben. For me, I think that I would answer that question by going back to how medication dosages are determined. And in general, there's very careful studies, pharmacokinetic studies, that help us to arrive at a perfect balancing point between effectiveness and acceptable level of side effects. And so in general, I tend to stick pretty closely to standard dosing, partly because as an HIV doctor, one of the things I'm most afraid of is for the medication to not work. And so lower dosages, one of the concerns would be efficacy. Now, there have been many studies that have been done. For example, studies have been done looking at lower dosages of efavirenz. Efavirenz is a very good medication, but it does have some potentially very uncomfortable side effects for some people. So that particular medication, it does appear that the 400 milligram dosing is safe and effective. But I think that if we're looking at things from a side effect perspective, lower dosages don't always give you less side effects. And in fact, in the studies with regards to efavirenz, what they have seen is that even at the lower 400 milligram dose, people still had a lot of side effects. So as an HIV doctor, the way I think about this particular problem, side effects, which is very important, because we need people to be able to find something that they can take for a long time. So side effects are important. But my strategy in terms of managing side effects tends to be looking at switching to something altogether, rather than trying to use a lower dosage, which does come with a certain amount of risk.
So a question that comes up, Dr. Lin, is about the comparative doses of TDF and TAF. Is this a low dosing strategy or what's going on there?
Yes, that's a great question. So tenofovir comes in two forms. The older version is tenofovir disoproxil fumarate, or TDF. The newer version is something called TAF, or tenofovir alafenamide. And milligram by milligram, the standard dosing is quite different. TAF standard dose is 25 milligrams, and tenofovir is 300. Now, but these are completely different. They're different compounds, so you can't compare them side by side. It's sort of like comparing apples and oranges. So the 25 milligrams of TAF, I think about as equivalent to the 300 milligrams of TDF. So these are basically the same. Taking TAF instead of TDF does not mean that you are taking a lower dosage of tenofovir. You're taking actually an equivalent dosage, it's just that they're slightly different compounds.
And then I think the other big question that comes up is about abacavir. Is it possible to do a lower dosing of that drug?
With abacavir, I would say no. Abacavir, some people are concerned because there is a potential hypersensitivity reaction. So I can appreciate why some people may think maybe if I take a lower dosage that I can avoid this kind of allergic or hypersensitivity reaction. But that's actually not how it works. Abacavir hypersensitivity is really mainly a product of somebody's genetics. And in fact, we can do a test, a blood test, that will tell us whether or not somebody is at risk of developing abacavir hypersensitivity. It doesn't have anything whatsoever to do with the dosing. It depends on whether or not someone has a genetic predisposition. So I absolutely would not dose reduce abacavir, because what would happen is you would be using a insufficient dosage to control the virus. And that is dangerous because it gives the virus an opening to begin to build up resistance. So with abacavir, absolutely don't dose reduce. Stay with the standard dosing.
Well, that's really helpful guidance, Dr. Lin. Thank you so much. That's the end of this episode. Thank you so much for watching. In a moment, coming up on the screen, you will see links that will connect you with HIV treatment information in your own country and links to us at Plan B. We'd love to hear from you, your comments and your suggestions. Thanks for watching.